Now, in the first section of our lecture, multiple pregnancies, let's start with the overview of multiple pregnancy. What is multiple pregnancy and how it is classified and how we can manage the multiple pregnancies. So here, the classification in this section, mainly we will talk about how we classify the multiple pregnancy. And then what's the etiology and epidemiology of multiple pregnancy and care of women with multiple pregnancy. Multiple pregnancies, twin pregnancies or more than twin, triplets and quadruplets, the management of the pregnancy, if it's multiple, is different than the normal regular single pregnancy. So it's important that we should know how to manage the female with the multiple pregnancy or multiple gestation. So multiple pregnancies is the incidence of multiple pregnancy is about 3% of live birth are the multiple pregnancies. And usually multiple pregnancies occur as a result of treatment of infertility. When the fertility drugs are used, like Clomid and clomiphene citrate, usually more than one ova is released, and if it's fertilized, then multiple pregnancies can occur. So it's usually as a result of assisted fertility or as a result of treatment of infertility that leads to multiple gestation and multiple pregnancy. So its incidence is about 3% of live birth or multiple pregnancies. The complications that can occur as a result of multiple pregnancies is preterm birth are common because of twin pregnancies. Usually the onset of labor is early and they require usually more space to grow and develop. So as a result, the preterm delivery or preterm birth is common. Then we have fetal growth restriction. Fetal growth restriction is also the main reason for fetal growth restriction is limited space to grow that can lead to fetal growth restriction, and also as a result of decreased nutrition to one of the two fetuses, or if it's more than two twin, then so on. So mainly growth is restricted because of limited space and malnourishment of one fetus. Then also cerebral palsy can occur in multiple pregnancies also, and stillbirth is common. Stillbirth is intrauterine fetal death, and this is the case in usually one of the fetuses is mostly more affected because of the asphyxia and malnourishment. One of the baby fetus can not grow properly and gets less nutrition and become smaller and can lead to fetal death. So that's the stillbirth. So all these complications are common in multiple pregnancies. The classification of multiple pregnancy, we classify them according to the number of the fetuses, according to the number of placenta, amniotic cavity. All these leads to classification of multiple pregnancy. So classification is first number of fetuses most important. So it can be twins having two fetus, triplets, 3, quadruplets, 4, etc. as the number goes on. So up to triplets is not that uncommon. Twins are the most common. twin pregnancies, but triplets can occur and also quadruplets and so on. So number of fetuses is an important factor in the classification of the twin or multiple pregnancy. Next important factor is number of fertilized egg. That is given the name zygosity. Zygote is the number of fertilized eggs. Zygote is the fertilized egg. So if one egg is fertilized and it divides later on into two, that's different. And then if two eggs are separately fertilized, then it's two zygote, and that two zygote gives to the multiple pregnancies. So this is zygosity, depending on the number of zygotes present or number of eggs fertilized. Then we have number of placenta. How many placenta are present? That's named as chorionicity. Chorionicity is for the number of placenta present. Chorionicity. Then we have number of amniotic cavity. That's amniosity. So all these are the different types of classification depending on the number of fetuses, depending on the number of eggs fertilized, and then how many placenta and amniotic cavities are present. That gives the classification of multiple pregnancy. Then also the stage at which the cleavage occur, at what stage, depending on if it's morula is involved, if blastocyst is involved before the implantation or after the implantation, or when the embryonic disc is formed. All these four stages, if cleavage occur in those four stages, we can see different types of the multiple pregnancy that can occur. So cleavage, morula, this is the morula. It's formed at day 1 to 3, and then cleavage at this stage 1 to 3 in the morula phase of embryonic development. These are the stages of embryo development and embryological stages of the fetal development. So at stage 1, morula, day 1 to 3, if cleavage occur, the twin pregnancy that can occur is dichorionic and diamniotic. Dichorionic it means this twin pregnancy has fetuses with two placenta. So each fetus will have its own placenta and its own amniotic sac or cavity. So if you see in this picture, this fetus has its own placenta, and then it has its own chorion or amniotic cavity. So it has its own chorion or placenta or own amniotic cavity. Same with this fetus, the placenta and amniotic cavity. So this is they have their own sacs, same own placenta and same amnio. So at cleavage at the level of morula, day 1 to 3 leads to dichorionic, diamniotic multiple pregnancy. Then cleavage after the morula, then we have blastocyst. A sac is forming inside, and this blastocyst cleavage at the day 4 to 8. From 1 to 3 morula, then we have blastocyst formation, which is day 4 to 8. And at this stage, if cleavage occur, then the pregnancy or the twin pregnancy is monochorionic, one chorionic, and then diamniotic. So monochorionic, diamniotic. One monochorionic and diamniotic pregnancy is formed. Two sacs and same chorion, not the separate chorion. Then in the third stage, if there is, once the blastocyst that is formed, it gets embedded or implanted in the endometrium. Implantation of the growing embryo takes place in the endometrium of the uterus. So once the blastocyst is implanted in the uterus, cleavage at that stage, which is day 8 to 13. If it's cleavage at that stage, then we have the twin pregnancy, which is monochorionic, monoamniotic. So first we have dichorionic, diamniotic. Then in the second stage we have monochorionic, diamniotic. And then both are mono, one chorion, one amniotic sac. If you see, they have one chorion and they have one amniotic sac. Then in the fourth stage, once the embryonic disc is formed in the implanted blastocyst, then which is about day 13 to 15, the twins usually that occurs because embryonic disc is formed. Now the conjoined twins are developed. Conjoined twins are the twins which are joined together. They are not separate because the embryonic disc is formed and cleavage at this stage leads to conjoined twins. So in this slide, it's a very, very good explanation of the classification of the multiple pregnancy and also what types of twins develop as a result of cleavages at the different stages of embryonic development. So first, at the level of morula, we have dichorionic, diamniotic. At the level of blastocyst, we have monochorionic, diamniotic, then monochorionic, monoamniotic, and then conjoined twins. Then what's the etiology of twin pregnancies? It can be, we have two types commonly. One is identical twins and then we have fraternal twins. Identical twins are identical because the egg that is fertilized is one, it's monozygotic. One egg is fertilized that is later on divided into two and gives rise to twin pregnancy. So because it's developed from one zygote, it's known as identical twins because they are very, very closely resemble to one another. So they are identical because they develop from one egg which is fertilized by one sperm, and in the later stage of development they divide into two. So here it's identical monozygotic. It divides into two and they both have shared placenta. So they share the placenta in monozygotic. Then in the other type, fraternal pregnancy or fraternal twin pregnancy is dizygotic. Two separate eggs are fertilized by two sperms and then they give rise to the twin pregnancy, and in this case they have separate placentas because they are developed from two different zygotes or cells. So this is identical twin from the same zygote, one zygote fertilized by one sperm. But in the other case, it's dizygotic. Two eggs are fertilized by two sperms, and the twins that develop from these usually they have, or multiple pregnancies that are formed, they have separate placenta. Next, the epidemiology. How common is the twin pregnancy and how they are divided further. So there are, say about the 1,000 twins, if 1,000 twin pregnancies are studied, then out of these 1,700 are dizygotic, or we said in the previous slide, dizygotic are fraternal twins. Monozygotic are identical. So dizygotic are more common as compared to monozygotic or identical twins. So if 1,000 twins pregnancies are studied, then out of 1,000, 700 will be dizygotic and 300 will be monozygotic. So 300 are only, it's more than the 50% are the dizygotic. So 700 are dizygotic and 300 are monozygotic. Out of 700 dizygotic, they have all 700 will be dichorionic, diamniotic. They will have two placenta or chorion, they will have two amniotic sac. So dizygotic, all of them will be dichorionic, diamniotic, and out of these 700, 350 will be the same sex and 350 will be different sex. So out of 1,000, 700 are dizygotic, 700, all of them are dichorionic, diamniotic, and out of these 700, half of them will have the same sex, two boys, two girls, or half of them will be separate sex, one girl or one boy. So that's the likelihood, about 50%. Then if we go to the other case, which is 300 are monozygotic twins, they are the identical twins. Out of these monozygotic, we have 100 are dichorionic, means they have two chorions, and these 100 dichorionics, out of these 100 will be dichorionic, diamniotic, and 100, all of them will be the same sex. So my monozygotic, which have 100 of them dichorion, means they have two separate chorion or two separate placentas. They usually, all of them have the same sex. Two girls, two boys, that's the same sex, all 100 of them. Next, if 200 of out of 300 monozygotic, now we have about 200 are monochorionic, and these 200 we have monochorionic diamniotic 190, and these 190 are all the same sex also. Then out of those remaining 10, usually they are conjoined, and one is conjoined and 9 are non-conjoined twins. So 300 monozygotic, we have 100 dichorionic, 200 monochorionic, 200 monoamniotic, and monoamniotic, out of them we have 10, which out of which we have one conjoined and 10 non-conjoined twins. So that's the roughly classification, because mostly the monozygotic, usually most of them monozygotic, they are the same sex, but and these are the identical twins. The other one, dizygotic, they have half of them will be same sex, half of them will be different sex. So that's the epidemiology of the twin pregnancies if the sample is out of 1,000 twin pregnancies. Care of women with multiple pregnancy, it's very, very important that they should have special management, special antepartum care because there is increased risk of complications, and early onset of labor is very common, preterm labor is common, and usually because of twin pregnancy, if preterm delivery occurs, the fetuses or they are not very full mature developed, so they need special care after the delivery also, and they need special management before delivery also. So what are the some important steps for the care of women with multiple pregnancy? Specialist obstetrician care is important. Special midwives and ultrasonographers are required. So special management is required for multiple pregnancy. Regular ultrasound assessment is important to rule out any complications or any fetal growth retardation is important, or if there is usually if one fetus is affected and lead to stillbirth, then it should be regularly assessed with regular ultrasounds. Abdominal palpation or symphysis fundal height measurements are important to find out the growth of the fundus, because if the growth is not normal, it means there is some intrauterine problem or growth retardation. And the administration of corticosteroids should be avoided. And it's important to decide what will be the mode of delivery for twin pregnancies. So in the last trimester, especially if the pregnancy extended to the last 4 weeks of gestation, usually it is important that the lives of the baby should be monitored carefully, and presentations, ultrasound should be performed regularly to find out the normal growth of the babies or level of amniotic fluid that should be recorded and measured routinely. So mode of delivery should be decided and should not be left at the end. Diet, lifestyle, and nutritional supplements should be monitored and should be with twin pregnancy. Usually the females, they need the more nutrition. They should have a healthy lifestyle, regular walking, and good rest and good nutrition is very important for the mother with twin pregnancies. Checking up of blood count, iron, folic acid, and vitamin B12 should be regularly performed. So that was all about the twin pregnancies, classification of twin pregnancy, what's the etiology of twin pregnancy, and epidemiology of the twin pregnancy. Thank you for watching sqadia.com.